Right, welcome everybody to this evening's meeting. So just to introduce myself, for those who've just joined, my name's Ian Allinson. I'm president of Manchester Trades Council that's hosting the meeting this evening. It's been prompted because Greater Manchester Mental Health Trust plans to redevelop the Park House Psychiatric Hospital in North Manchester, and that sparked quite a debate about the future of mental health provision, and in particular whether the plans that the Trust has put together are appropriate in the light of lessons from both COVID-19 and the Black Lives Matter movement. So there's a letter that's been produced by the Greater Manchester Family and Friends for Recovery group to Andy Burnham, calling for the plans to be paused and revised. And the way we're going to run the meeting, this is an open meeting to absolutely everybody. We want to have an open discussion about the issues, but towards the end of that, we'll actually take a vote for Trades Council delegates only to vote on whether or not the Trades Council should add its name to that letter. But we don't want this evening's meeting to be dominated by a kind of yes/no debate about that. We want to discuss the actual substantive issues as much as possible. So we've got, as far as I knew anyway, two speakers this evening. So first of all, I'm hoping Andy Burnham or one of your colleagues from the Greater Manchester Family and Friends for Recovery campaign can explain a bit about the issues they've been raising with it, and then we'll have a speaker from Unison Greater Manchester Mental Health branch talking about their perspective on these wider issues.
Yeah, I was just going to say that we're going to split this between myself and Paul Baker, who are both members of the Family and Friends group. So Paul's going to speak a little bit about the lack of consultation. Then I'm going to talk about some of the issues, and then Paul's going to come back and talk about a kind of the possibilities of a different future.
Welcome everybody. Thank you so much for inviting us to this meeting and for facilitating this conversation. I'm a mental health activist. I'm an international mental health consultant on looking at innovation and developing partnerships around a community-based mental health approach. So that's my speciality. And I'm working in Manchester, particularly in Hume, with a group of people where we're trying to create a reciprocal community where we have a peer-to-peer approach, but that involves citizens, workers, and people who are users of mental health services. So we've got quite a different take on what we think the community needs. But this vision we've got is not something which we just made up by ourselves. It's actually supported, evidenced, and is really something that the United Nations and the World Health Organization want us to do, which is move from a kind of clinical model of mental health care towards a community-based mental health care, but also not necessarily forged around a clinical understanding of distress, but also opening up the possibility that distress belongs to social determinants, that often crisis arises because something happened to you. In fact, you could summarize it to say the important question in psychiatry is not what's wrong with you, but what happened to you. So this is driving forward from, we can see there's a shift in paradigm, and there's a real challenge to the kind of bio-psychosocial model and wanting to drive towards something else. Now, the difficulty with the determination that Manchester needs crisis support beds on one single site in the north of Manchester is a solution that we believe has been made because it's a service-centred solution. It meets NHS needs. And when the opportunity arose, when Boris Johnson came to visit the city and promised that North Manchester would have one of these hospitals, it put a lot of pressure on them to deliver something. So in the past, we had hospitals, if you like, in central Manchester. It used to be the EDL unit on the MRI site, and we had services around the city. The idea now is to have a site that serves all of South, Central and North Manchester from Crumpsall. This causes some immediate difficulties for patients and families who don't live north of the city, because you have to get through the city to get to the service. It's not locally delivered. It's actually relatively remote and unaccountable as a solution. Now, We know that they have been planning this from 2018, but it was a very small, narrow group of stakeholders that reached the determination that there was a need for a rebuilt hospital. They didn't really involve anybody else in those discussions. So rather than saying, what's the need, they jumped straight to the solution. There absolutely is a need for crisis care support beds in our city. No doubt about that. The issue is, what shape and form do those crisis support beds take, and do they need to be kind of wedded to a kind of very biological and clinical modality, which is actually, we think, stressing separation. We know that from talking to trade union members, to talking to service users and family members, that one of the big issues facing the current unit is violence and aggression. And that's not acceptable. I mean, it's a lot of issues. The issue facing the trust is that the conditions of the building are such that they feel that they contribute to people's ill health, and therefore extend the need for them to be in care and mean that people don't leave psychiatric care when they should. However, when we discussed this with them, I've been to a number of meetings that they've held. They are not open to any discussion at all about the building. It's a set, it's the solution, it's going to happen. All they're asking us to do really is to give our opinion about some very rather generalized ideas about what could happen within that space. So it's not very specific. And in the meetings that I've attended, hosted by the Greater Manchester Mental Health Trust, they have had very few people attending those meetings. So they had one meeting for voluntary organisations. There were about 5 people there, there were almost double the numbers of Greater Manchester Mental Health Trust management staff. Further, I was at a very disturbing meeting that took place in Park House, where they had a meeting for Manchester Users Group, where 5 people turned up. I was there as well. And there were 10 staff from the Greater Manchester Mental Health Trust standing around the room, and they were trying to really push an agenda that they wanted us to hear about what this proposal was about, and wouldn't listen to the issues and needs that were being that the service users wanted to hear. So I think this is really interesting that they're holding a consultation exercise actually in one of the quietest months, August, and they've really upped their ante. This isn't really consultation, it's promotion and marketing. They've decided on the solution. It's not really open for consultation, and they've done a number of things. They've sent out to everybody living within 1 mile of the Crumpsall building, have received a letter and a pack, very, very, really nice information, lovely design buildings, etc., 3Ds and all the rest of it. And they're holding a series of meetings for specific groups to hear what people think of the opinion, but they're doing it very, very quickly in a very short period of time when a lot of people aren't available because of childcare needs, it's holiday time, and also many of us just want to chill. It's not the time we've got our heads on and saying, what's all this about? So to summarise then, this thing has slipped through. It was signed off by a very small group of stakeholders, and it's been presented to us as fait accompli. However, as Andy will now see, we think there are serious difficulties about them not thinking about the need before the solution. And I now ask Andy if she will tell us about the kind of issues that we've asked and addressed in the letter and the briefing document.
Okay. One of the first things that I'm going to mention is that in the kind of PR for the hospital, they've talked about improving recovery, etc. Yet I have family members in very nice buildings at the moment, but it hasn't enabled recovery, because what is needed are an awful lot of other things to be in place to enable someone to get over traumas that they have faced. And there are members of our family and friends group who have had people in and out of services for 17 years, and they see the same people again and again on the wards. So this notion that some sort of recovery is taking place is a slightly spurious one, because they wouldn't be meeting those people again and again if they were on another journey. So if we look at some of the issues and the lack of vision, in a sense, about just building a single unit hospital in in North Manchester. We know that in Manchester, it's got a real unenviable record in some of its mental health services. So the use of physical restraint is much higher than in other parts of the UK. It's got the worst record in the country for missing patients. Too many Black people are coming into contact with mental health services through the criminal justice system, not through their GP. Black and minority ethnic patients, when they are in hospital, are much more likely to be in seclusion, forcibly medicated, use of injections, and this highlights in a sense, the inadequacy of the current service, which no single building is going to resolve. Even if you had just smaller hospitals across the city, you could have people closer to their communities, to their networks of support. And we know that in mental health services in the country, there's the levels of racism that are faced in terms of people accessing psychological therapies. Black people are much less likely to access those, have access to those therapies. We know that NHS staff experience racism, and then that's obviously going to impact on the way and on the kind of services that they can offer. So there are huge kind of issues, and a University of Manchester study found that tackling the impact of racism was in fact the #1 priority to reduce ethnic inequalities in severe mental illness. So there's nothing about this building, there's nothing in the consultation documents that suggests how what they are providing is going to do any of that. And actually it's really worrying. At one of the consultations that Paul was at, one of the people from GMMH, when asked what was going to happen, said that's a national issue, as though this shouldn't be taken on board when you're going to be investing. And it seems to have gone up and up and up, the cost of the building. It's now 105 million. I think it started off around 75. And so these are kind of like serious issues. We know Black people are 4 times more likely as white people to be detained under the Mental Health Act. Part of that is because they don't get services in the community. So, we have to look at these things in a kind of much more interconnected way than is happening, at present. There are major human rights issues, and having a look toward a more use of physical restraint, a medical model which is almost entirely based on medication, and really pretty much nothing else, is not going to resolve the problems of people that have suffered multiple traumas in their life. In producing the documents that, for this letter, the briefing documents, there was one a piece of data that really disturbed me. And this was from 2016-17. And it actually speaks about the way in which girls and young women under the age of 20 were the most likely to be restrained and could be subject, or some of them are subject to being restrained 30 times a year on average. So you're talking about pretty much once a week. Now, these are people like, why do young women end up, in psychiatric services? We know that one of the key reasons is abuse. And then you're having people pin you down, and actually you are ending up re-traumatizing people. So we need to find another way which isn't based on such levels of coercion. I think the other issue that which is very important, and that's why we need to think about a much more integrated service, is that actually the number of people being detained has gone up, it hasn't gone down. And that's because of the crisis in community services. So, okay, we know one of the things that has been mentioned to us in the discussions with people is that this is from a particular kind of budget. This is a capital spend budget as opposed to like a year-on-year service budget. But even then, if we were delivering different kinds of services across the city, you weren't just having all locked wards and based on restraint and that kind of system. There may be ways of reducing the number of people that were actually going to be detained in hospital. Now, another issue which is crucial is the fact that we are now in an era of, if you like, pandemics. We don't know how long the pandemic is going to continue, and it's well known that large services are much more prone to infection being carried across them, and so that they're much more vulnerable. So why in 2020 design a building which is going to have, I can't remember the number of people, 160 or whatever it is, in a very small space? In fact, the physical footprint is going to be smaller than the current Park House, which is why they're doing it on 2 levels. So I think these are all things that we really need to think about, and we want to just simply at least start a conversation with the city, with GMMH. You know, we also know that one of the reasons people end up in crisis is because of vulnerabilities in housing and everything else. We need an integrated service. And when, you know, some time ago, a couple of years ago, this is what Andy Burnham mentioned, that Greater Manchester had a chance, because it was the only city with health devolution, that there was a chance to actually integrate health into everything. So we feel that we really need to take that opportunity. And even if it's about building buildings, that we need to think about what we want in relation to that. And that this whole consultation needs to be much wider than it has been at present. So I'm going to hand it back to Paul now to talk about some of the alternatives.
Yeah, I'm just thinking that this is heavy stuff, so I'll sort of take a breath. So yeah, so there is another way, and we know that I've been working with services that have been working for 40 years in very different approaches. Manchester regards itself as a kind of, you know, we've got a global reputation. We've got a reputation for doing something different. You know, we've got a reputation for doing multiplexes. We've got a reputation for creating the hacienda. You know, we've got a different kind of vibe. We do things differently, but we're international. We shouldn't be so parochial. This leadership in Greater Manchester seem to be looking backwards and upwards. They're not looking towards us and engaging with us. So what would be a really positive alternative? At the moment, we have a real disconnect between what goes on in the hospital and what goes on in the community. And there's a big gap between the two. And the discharging and stepping down arrangements are horrendous. They are, for any family member or service user will tell you, they are so complicated. You get pushed from pillar to post. And the difficulty is half the staff group, the healthcare staff group in the hospital, and the social care staff are somewhere else. You can bring them all together. And you can, we know where services have been developed where they have maybe 12 beds, but they have a whole series of other things going on, and they've combined social care and health staff to provide a holistic whole system service. And they also be able to do it 24/7 with, you know, with single point of access, and also with no threshold. So we can envisage a way, and it's not based on imagination, but services that have been running like this, which actually counter the idea that you have to have people locked away to keep them safe. That this is the solution. They managed to run their service, and this is a service in Trieste in northern Italy, where they actually do not have any locked doors, and they do not use restraint, full stop. They use negotiation and de-escalation. And if somebody wants to leave the building, they just follow them and find it where they want to go. And most of the services are home delivered. They provide a home treatment service because the psychiatrists are in the community. Most clients in the city in Trieste, which is not that much smaller than Manchester, they have the psychiatrist's phone number. They can call them up. You know, but what we've got in this design, if you have a chance to look at it closely. It reminds me more of an open prison than it does a place of healing and support and recovery. To keep people safe, they have effectively put glass stations all over the place so people can be observed, but the workers can keep safe. But we know if you disconnect, if you separate, you don't deal with the problem, you just create new problems. And we know that what people ask for, what helped you in your recovery journey, they tell us that it was about connection, trust in the relationship, which enabled the therapeutic alliance to work in the first place. So you've got to enable connection and trust and continuity. We spoke to Unison last week. They were taking a collective grievance against the trust because of the unsustainability of community care services in this city. The care teams are in crisis. They've got massive waiting lists. They're piled over with paperwork. Most of our workers now spend 50% of the time doing risk assessment and paperwork rather than doing face-to-face work. It's overly bureaucratic, it's overly concerned, it's risk averse, and it's not meeting our needs. So we are calling for a conversation. We're not saying we have a solution as such, but we would like to contribute to the solution. And we have on board people from World Health Organization, European level, and also locally, who have got amazing expertise to contribute to delivering and thinking and imagining a new kind of service. We think wasting £105 million on a service which could become redundant, like previous services have been made redundant, based on a premise which we don't think is evidence-based, is missing the point. And we really want to try to get around the table and use Andy Burnham as a convener to call Richard and Neil Thwaite and these people together to say, let's find another way. We have the creativity in the city to do that, and in this county too. Thank you.
So next I want to invite a speaker from the Unison Greater Manchester Mental Health branch, which I believe is Jane Lee. So do you want to speak, Jane?
Yeah, I can only say that I agree with a lot of what the speakers have said, and that there are union members and members of staff within the trust who have fought for a very, very long time for the sort of changes that you're talking about, and, you know, members of staff who have family members being treated by that system. So I think I'll just start by saying totally agree with the fact that you can't have good mental health and mental health recovery just by looking at the mental health service. It has to be a systems approach, that the stigma in society, if people go for jobs, if people, you know, try and get back into university, college, regain social networks, is, you know, alive and kicking. And not only that, but that it has a major impact on people who have these diagnoses that I believe they shouldn't be given, like schizophrenia, that then devastate them and create isolation because they're fearful of going back in society, even if positive opportunities are offered, because they feel that they will be rejected, and that's shown over and over in the research. If you look at the city, homeless people, is it 80% have mental health problems? We haven't got enough houses in the city. The education system is such that people don't get another chance, and you could go on and on. So it needs to be done in a, you know, a citywide, or we're a Greater Manchester Trust now. I've always worked in Manchester, but a citywide solution to this, as well as go sort of working backwards to Park House. You mentioned about community services and the model of mental health services. And, you know, it's like you might get half a step forward and then you get whacked back a couple of miles. And that's how it has felt working in the service. So, for example, I agree with we need to look at different, you know, models of care, looking at distress rather than distress models that you talk about, the actual experience of being diagnosed and being within that system is a major trauma in itself that a lot of people do never recover for. So the mental health services are part of the problem in lots of ways. There's institutional racism across, I think it, and I've asked over whenever these figures, what are we going to do about it? And like you were saying, they always reply to you, oh, this is a national problem. Oh, this is an international problem. But if somebody doesn't do something about it in one place, like you say, where's it ever going to stop? The figures of restraint and young black men being you know, put in locked, more highly secure facilities is well known. You know, there are cases where there was one in London some years ago where a young black man was killed through restraint. And the reason that he was restrained, the background to it was that somebody had been racist towards him on one of the wards. He'd suffered racism for years, and then he reacted by being angry, and rather than the instigator of the racist incident being moved, he was moved. So his anger escalated. And then he was restrained. And his sister was a doctor, and she took it right the way through court. And, you know, all the figures were revealed. The people detained in police custody with mental illness. So, you know, this is known. All these things are known. But when you're trying to get positive changes, what happens is that the very basic services are being cut back and cut back. A couple of years ago, they tried to get rid of 8 services. One was for employment opportunities. So they were all the services that were the most, you know, recent and forward thinking. There were about 8 services. I won't go into all of those. And we had one of the unions supported the service users in taking legal action against the trust and the commissioners, because the commissioners were letting this go ahead without any form of assessment, which they're required to do under the NHS Act. So they backed down on that. Now, and before that, they were trying to cut mental health services. Again, we had a campaign. More recently, with this merger with GMMH, we had a massive opportunity. And Manchester Unison were really pushing for the union to demand that there were more and more staff within the community teams. That opportunity was missed, I feel. And the pressure, as you say, I think it was Paul, you were saying within the community teams has been horrific. People have left. People have taken early retirement. There are vacancies. They can't cover the basic safety in terms of providing care coordination. Therapies, you know, I always argue that the CPA process that people are put on, care programme approach, where you've allocated a care coordinator who organises your meetings, etc., is a process rather than a therapy. Of course, it's not going to lead to recovery. So this word of recovery is, like you say, meaningless. So, but it means that we're constantly battling against, you know, cuts in services, vacancies, and you never get to the stage, or very rarely, where you can say what is needed is a rethink of the whole of mental health services in Manchester. Manchester is a health and social care trust, because Manchester Mental Health Trust that was merged with GMMH maintained that. So we were, you know, we have got the social care staff within the trust, and the social workers are care coordinators and work alongside occupational therapists, psychologists, nurses. So things are pretty dire. And then on top of that, you've got the social problems that you have had, which have grown and grown and grown. And like 25%, I went to a meeting, and I couldn't believe people didn't seem shocked. 25% of people under our community mental health teams are deemed homeless. That doesn't just mean rough sleeping, it means they haven't got a house. They're either living in temporary hostel accommodation rife with drugs, which leads to other problems, or they have got, or they're, sofa surfing, really unstable lives. Is it 3% or not even that sometimes of people with serious or diagnoses of a serious mental health condition are unemployed, which means a life of poverty. So they're denied access to the very basic things that every single other person in society has more access to.
Yeah.
I won't say everyone. Park
Find your
House.
comments up soon, please.
So the Park House bit, I'll come back to the very beginning. The Park House development, I went to a meeting today, which was a consultation with staff meeting, and I had to really demand to be involved, not as a Unison rep, although I did tell Unison, and I did tell the user network, and asked if they've been consulted about this. So we were, like you say, you presented with, well, we had 3 designs to choose between, and we chose this one, and the money is ring-fenced. The money, apparently, that the government have given is ring-fenced for the rebuild of Park House. Park House, I think Ben spoke at the KOMP meeting, Keep Our NHS public meeting last week, and he described a horrific situation on the wards that even, he said that, well, there's 4-bedded dormitories for a start, and especially in the middle of a COVID pandemic, should have been shut down because of the risk of transmission. People were coming in and out of those wards. At first, they weren't even being tested on admission. And I don't even know if contact and trace, we have raised these things, but in the best of times, it's not a good building. People are in dormitories, they haven't got access to private facilities, the room is inadequate, access to outside space, access to gym equipment, health programs, and all things like that are non-existent. So you're presented with this building that, like you say, looks nice. It's got a nice picture. It's a they wanted 1-level building, but it's actually 2 levels because of the space that has been allocated. I'm not supporting this, by the way, and saying it should go ahead, but there is outdoor space, there's access to outside gym equipment, therapeutic areas. Within, there's a lot more space, apparently, for therapeutic areas. There is private bedrooms with ensuite shower and bath facilities and access to TV, computers, Wi-Fi. This is what we're being told. On the outside of the ward area, which can be accessed by people, is a cafe area, a big gym, another big area, and some therapeutic space that can be, they haven't gone into detail about what that space could be used for. So to staff, obviously, and people like Manchester User Network, this will look like a sort of palace compared to Park House. So I can understand, that people are saying, great. But also, look, some of the staff are saying great, and there's a feeling that it may be rushed because they want to get the money while they can have the money, and before it's withdrawn, maybe, and that is what they will be saying, and I'm not excusing them for this. What they say today, I've just lost my thought. What they say today is that they are going to take it out for consultation, but I agree with you, it already looks like, you know, the plan is more or less there. I know what I was going to say. Alongside this was this sort of asking staff about all the professional leads from like psychology, occupational therapy, nursing and everything, to consult their staff and find out what, you know, they wanted to provide. I'm talking about this from a Unison member point of view. Then when people started to say new things that moves towards a social model of care, less medical, more alternative complementary therapies, more, you know, bringing on dietitians, physiotherapists to use this opportunity.
Can I ask you to wind up, because we want to make sure there's time for everybody to take part.
So they allowed us to say all these things, but then said, well, they want any more money. So they've just replicated the exact staffing that happened before. So now they're saying that it's going out to public consultation, planning permission. So this is the time that they're supposed to be taking it to the public. But I agree, there wasn't an open discussion. Even prior to the trust putting in the bid for the rebuild of Park House, there should have been a discussion then about, you know, how we can make mental health services therapeutic, like you say, therapeutic places.
Thanks very much, Jane. I'm going to ask you to stop there. It's really useful to get perspective of people, you know, working in the service as well, because what we want to see is that kind of unity between the people using the service, their families and friends, the people working in the service, all trying to get the best possible support for all of us who need that support.
I'm Caroline Bedale. I'm now retired. I used to work in the NHS and I was branch secretary, joint branch secretary of the Unison branch for a number of years in the mental health services, though I wasn't actually a mental health worker. And as Jane said, we have battles to save services, and that's one of the problems we, as trade unions, we often have to fight very defensive battles to try and save services, to try and save funding, rather than actually fighting for the things that we would have liked to be fighting for. So we weren't usually able to choose the ground on which we fought battles, and I suspect that the same is true now. So I'm sure that staff at Park House will be looking at the plans and think, goodness, this would be such a better place to be able to try and provide a decent service for service users. And there just isn't the opportunity being given to people, whether it's staff or service users or carers, to say, let's actually sit down and talk about what sort of services we would like. And so when in the past we fought to try and save some of the recovery services, things like creative arts, woodworking, gardening, the sort of things that are good at trying to both improve people's mental health and once it is improved, to try and keep them well, those had tiny amounts of money spent on them, but those were the very services which it was proposed to cut. And the community mental health services, which Jay mentioned, are going through a grievance, I think, at the moment about just the completely unacceptable levels of workload that they have, just their inability to be able to provide a good service for service users. They also are very much underfunded compared with the buildings. So, I mean, I would support a lot of what's been said about the amount of money that is poured into buildings, and actually via that to private builders. It's not the NHS. That 105 million is not actually going to go, in a sense, to the NHS. It's going to the private sector who would be building this building and refurbishing it. But I think one of the problems is that it's much easier for the government to put money into capital, which is what they're saying this money is for, as Andy said, and that what's really needed is a lot more money and a lot more discussion and thinking about where money could be spent to provide a whole range of services, not just within the NHS, mental health services, but as Paula said, within the whole community, to actually provide a better society, so which might help some people not to get so ill in the first place.
Thanks,
So we've got a big challenge. We've got a very big challenge for this campaign.
Franklin Ellis, the TSSA rep on Manchester Trades Council. I live in the area where the consultation takes place, and I have got one of the letters for the consultation, including virtual exhibitions. Is it worth my while contributing to this? Because Park House is a relatively modern building as buildings go. It's not a very old building on the Crumsall Hospital side. And one wonders, again, if it wouldn't be better to have more facilities in the community. Thank you.
I want to say yes, yes, yes to lots of things said, but I'm not going to elaborate and repeat them. I'm just going to bring actually a new piece of information to you. I'm a secretary of something called the Mental Health Charter Alliance, which very few of you will have heard of. One or two, I know, sprinkle some places about it. And I want to bring to users and carers. Had a lot of proper discussion with community groups, yes, and people involved in the NHS over what they wanted. And he put together a charter of rights, of which number one is we wanted to be listened to. Others are basic, in ordinary language, about wanting to be involved in decisions about care, be involved in decisions about services, not being treated in a stigma in a negative way, being treated with dignity and respect. And that actually has been signed and endorsed by the Trust. It's a legal document. And we're a very small group, virtually no funds, with volunteers. And I can see Pete Marshall is now the chair of the group in Manchester, involved in that team. And he's brought a good voice of people with mental health needs, of autism and neurodiversity issues into the discussion. There is a charter. And I've sent out a recent article via the National Survivor User Network, a national body of service users and carers, and discussion with them, and linking the demand for the charter, and I'm looking at the Trades Council, going back 200 years, what led to the charter and more democracy in the country. We can look at positives and negatives about that. It'd be good to look at comparisons. And all the negative issues that have been discussed by other people raised in here, and some of you know a lot more about them. We believe, they believe, locally it's been endorsed, service user patients' rights need to be upheld, very simply, in a fundamental way, because they are being failed left, right and centre. The difficulty we have is that we have very little power. We want to show the wider use of the charter. So I'd like to bring that to your attention. If your colleague has never heard of it, I'll send it. There is a Manchester Mental Health Charter, which was endorsed by 200 people over a period of time. There was a proper and genuine discussion in putting this together. I feel it might need to be amended, and we'd like to have wider consult. So I'm bringing that to your attention, the rights of service users, to right to involve them in decisions, not just about a one-to-one level with a psychiatrist over decisions made about what drugs they should or shouldn't have, and discussion about how services are planned. It's there already, and I'd like to bring it to you and your colleagues' attention.
Hi, I'm not going to repeat what Tom said, although obviously I agree with it. One of the things that we have managed to create, which I'd be interested in seeing whether the group that are currently at tribunal with the Mental Health Trust would be interested in, is we have a stepping down report, which basically we spent months and months and months and months are basically wanting to talk about the fact that loads of people are getting stepped down illegally, blah, 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 bad results, blah, blah, blah. And basically we managed to get them to put some money into and get Mind and getting some professional researchers and that kind of thing into an actual document that basically vindicates everything. Talks about how badly the system is working, talks about how badly some of the effects are, etc., etc., etc. So just to say, that is kind of a fully, and the NHS Trust don't disagree with it. So they signed off on it, and it's public information. So honestly, I would be very interested in seeing whether that would help the people at who are currently in court against the tribunal, if they would be interested in using that.
So Well, just this whole notion of a hospital and what a hospital is. So the definition of a hospital is just a place where you get, you know, medical care for some kind of health issue. It doesn't have to be on one site. Now, it's very clear that they know that the space that they've got Park House isn't enough anyway. And yet what they've done is just squeezed everything in and created other problems like infection problems, etc. Plus the fact that it's remote for many, many people. Now, if you had, or you decided you were going to spend the building costs on revamping a variety of buildings, or even if you were going to build some smaller hospital sites across the city, you could be providing services where people had community support, family support and things like that. You could also, in fact, be integrating the community services with hospital services. So it's like in the community, there's huge problems with like psychologists not having a space, you know, they're all squeezed in here, there and everywhere, OTs or whatever. You could have these spaces that were used by both hospital patients and people in the community. It would mean that when people were in hospital, they might see a psychologist and they could continue with that psychologist in the community. Whereas now, everything's pigeonholed and segmented. There is no continuity. This is not the way in which people recover. You know, being pigeonholed and boxed off here, there and everywhere. You know, you can't use this service here, you can here. And then, you know, you wait for 3 years, but then your circumstances change, so you're no longer allowed access to that particular psychological service. I mean, it's a joke. So, you know, this is a way, if they thought more creatively, even if we look at it on the basis of buildings, this could be a way where they could actually integrate resources for both hospital care and your traditional hospital care and community services. And all the hospital care would not necessarily have to be locked beds. If they started thinking like that, then they would be rethinking the service. If all they're going to do is to provide a hospital service with locked wards, then they are not really trying to look into what really 21st century mental health care should be.
Right, I want to say that I agree with what Andy said. I'd already put on the chat posts about community care, and I do not think that a huge hospital is a good idea at all. I believe that, well, for a start, more money needs to be ploughed into community care in regard to what the last lady said. But I believe that it's much better to have smaller community treatment and help and support near where people live. And that people who are partway on the road to recovery and who will benefit from activities and therapy, I'm sure that they would benefit more from a community-based approach than being stuck in a huge hospital. I don't agree with locked wards. I do not agree with the restraint that we've heard about and that I know has taken place where I was once staying, is inhumane. There's lots more I could say. I'll end with a model. Some of you might have come across Mood Swings in Manchester, charitable organisation set up in 1999 by Tom McAlpine. They have all different activities, ones that have been mentioned. They have drama, creative writing, singing, walking, football walking. They have one-to-one counselling. The director who's in charge overall for mental health, whose name I've forgotten, he came to visit Mood Swings, and he had a quick look round, had a chat with a few of us who were discussing what was going on and the future for mood swings. And I'm upset to hear that the approach, that, what should I say, that that there's not more consultation with service users, because there should be. Service users are the ones who know exactly what's going on.
Yeah, so I was just to ask, how's this development being funded, and what sort of flexibility is there over how that money is spent? Is it like from a specific ring-fenced fund, like government grant, or is it local funding that various things can be done with?
Yeah, like everyone here, I could talk all night on this subject, but a couple of things that I find it frustrating, because a lot of these conversations, it's interesting now, as I much as agree with them, we keep having them, but not much seems to be moving on. And I think, you know, talking about what Karen said before about needing more money, you know, that power of the state, I think, you know, the evidence shows us, the work of Robert Whittaker in America has showed us the more money we plough into this model, the worse mental health gets. So if you have less money, as we do in a lot of Asian countries, a lot of African countries, where they've not got the money or the culture to spend on this medical model, their mental health rates are going like that, and ours are going like that. So, you know, the evidence is there. And also about the different models that people are talking about. Paul could tell you a million. Some people have talked about them today. The models are there. They've got an evidence base. Our Royal College of Psychiatry have published the Power Threat Meaning Framework, showing, demonstrating an evidence-based different approach. But still people aren't listening. And I think that's what the problem we've got. We've got the evidence, we've got the heart, we've got the energy, but nobody's listening.
Yeah, I just want to come back on a couple of the points that have been raised for information purposes. It's very interesting to know that part of the hospital that's not part of this main bid is the rehabilitation facility of 25 beds. We're hearing that they're saying it's going to be part of another bid, but there's issues there about what's going to happen to this 25-bedded part of the unit. Is it going to have to keep running whilst they find the money for the second part? Secondly, we suspect they're going to it's going to be privatised, or it's going to be tendered out to a NGO or a private provider. So that's really a worker issue there about what's going to happen with those beds and what's going to happen with those spaces, because they haven't got room for it. So it's also not going to be a North Manchester site, it's going to be somewhere else. Now, the second thing is to know is that Tacito House, which was a purpose-built brand new hospital in Ardwick Green with 30 beds, most of them en suite, is empty. It cost £9 million to build it. It was built by Alternative Futures Group based in Knowsley. Is intended to be a borderline, a trauma-informed service for women with borderline personality disorder. It ran for about a year, got no support, no referrals from the clinical commissioning group. There are also biggest staffing issues because the people work, even most people who mainly came from the NHS, were just not trained in trauma work, so it didn't work very well. Somebody died. It's been empty for 2 years. It's still there. It's on the market for 4 million. I can get you 30 beds for 4 million quid. Figure out 105, you know, I mean, it's there, it's ready to go. They could remodel it for another million if they wanted to maintain a bit of dignity. But that also, it's in Ardwick. That serves the needs of Moss Side, Hume, Ardwick, Rusholme, you know, and these are the communities which, alongside Harper Hay and Moston, are the ones that are in trouble and need our support and need the community infrastructure. Also, you know, we've got Cath Brook Centre. There's an empty job centre next to it. You could remodel that into a community care plus residential support. But they're very single-minded in what they want. They don't see this as being any other options, and that's the difficulty. We believe you could invest £105 million in a series of services much more local to the way that people are provided, possibly at a cheaper cost, certainly more ecologically. The other thing to say is that when we tested them, I asked them, you know, what is this new model? They said it was biopsychosocial. That's the model from the 1960s. It's not the model from the 2020s. So inside the NHS, there's a kind of parochial culture. They look in at each other. They're not looking out to see what else can be done. And they've inherited something from a culture that's come before rather than exploring new possibilities. But none of the things that we're saying are particularly difficult to achieve. We could bring an expert panel on board of international, national and local experts who could help drive forward this with worker energy and with, you know, lots of other people. So what we feel is that this service, its fundamental difficulty is not founded on human rights. It's founded on compulsion. You don't get an access to this service unless you have to have it, as Karen pointed out. This is highly problematic. Unless we can escape that trap, we are always going to be, you know, under the hammer of this kind of service. And I think we deserve the kind of psychiatric, societies deserve the psychiatric services they get. We need to be more vocal, and we need to be, that's why we model this as a citizens campaign, to try to open up and create a coalition of interested parties to challenge the idea that this is the solution for the next, 30 years probably.
It was just very quickly, because I've been trying to look at the chat as well as listen to what people are saying, and I hope that somebody's going to save the chat because there are some really good points being put in it. But I suppose I am, despite all that people have said, I'm really concerned that if this money is only available for the capital redevelopment of Park House, and there is then a big campaign to pause or to stop the redevelopment of Park House, are we going to just lose that money for Manchester? And I fear that we would, and that what we really need to be doing is saying, yes, Park House needs to be redeveloped. It's a terrible place to work and to be a user at the moment, but we need at least matching funding, if not more, to develop the sort of services that people are talking about. And I think, as Ian said right at the beginning, it would be really unfortunate if this debate or any decisions or votes or anything became an either or, an either hospitals or community, either redevelop Park House or do something different. We maybe in the short term will have to agree to Park House being redeveloped, but we absolutely have to keep up the campaign for properly funded mental health services that meet people's needs, that recognise the places where people live in Manchester, in Greater Manchester. So I just would ask, don't let's throw out everything. I think we just need to be careful about this. Thank you.
Yeah, sorry, this is just, on Caroline's point. So if the current stage, it's like proposals for funding that's been allocated to Manchester for a new hospital or redevelopment of an existing site. I mean, what is the risk that, how big a pause is available within that window? What is the risk that, I know it's not us making the decision, but in terms of in terms of a realistic ask, like what is the risk of that? If it was paused, what is the risk of the money just going elsewhere to another part of the country, basically?
So just listening to the contributions that we've had as we've kind of moved on to the more practical, what are we going to do about it side of things, and some of the comments in the chat, I guess it'd be useful from Trades Council delegates. I guess we'd frame this discussion as being like, do we sign the letter that exists or not? But it sounds like quite a lot of people think they support what's in the letter, but that saying that without saying some other things as well might not be quite the message they want to send. So I guess an option would be for the Trades Council to say basically what's in the letter, and to say, as Karen just put it, that the existing facilities are unacceptable and need to be improved. I guess.
Okay, so to begin with, at the end of our letter, what we say is, we've put forward the things that we believe in, but we obviously realise it needs a wider discussion. So the key thing that we ask for is a conversation and a wider discussion. So that's the first thing. The second thing is that, yes, the facilities at Park House are poor. I've been into Park House myself and seen those 4-bedded wards, etc. So it's not good. And we're not saying that there should be no investment. What we're saying is that if you're going to have a capital investment of 105 million. Well, let's think about a hospital in a much more creative way. Hospital sites that are across the city, that are able to begin a provision that would allow much more integrated services between inpatients and those in the community. So what we're saying is that the kind of system, the kind of building that they're suggesting is not going to change anything. And what we're going to then get is, well, we've had 105 million spent on mental health services in Manchester with, you know, little thought about what's going to happen going forward. So we're not saying don't bring this to Manchester. Of course we want to bring investment, even if it's only capital investment, never mind all the other services. Of course we want that to come to Manchester. We're saying, can you not at least pause for 2 or 3 weeks, have a conversation and rethink what you're actually suggesting here?
Yeah, I mean, I kind of really appreciate the concern that if we were to lose this money, it would be devastating, and indeed we would like to see that kind of investment in mental health services. I think what the point we're making is that even if it proved impossible to not have the hospital, that we would really want to have a lot more influence over what goes on in that hospital, and that some of the issues that we talk about in the approach are taken on board. And it might be their vision of, it might be that they might keep the shell of the building, but they really rethink what goes on inside it. We wonder if the idea of glass and protection and nurse stations is really answered. The modern services get rid of the nurse stations to ensure connectedness, and then enable workers to do the work, not to just spend the time writing notes and having to record the assessment processes. So it's about where we're able to put our energy. And we're not the only health board that's looking at this. I mean, we're working with York, Hywel Dda in Wales, and they're all coming up with a different idea of community. What they're looking at is a single-sided service, which is 24/7, no threshold, has crisis support available to it, but which actually houses all the workers together, including the psychiatrists. So there is another vision for this, but we are aware that that might remain a vision. However, we do want to influence what happens within the service, and we feel that because the process was cart before horse, they need to pay attention to what we think is needed, and that needs to be fed into discussions in much more specific and realistic ways. So we have an investment and feel that we've been treated like real stakeholders rather than just being called that.
Yeah, I think one of the most important things to come out of this already, and as I say, I went to the KOMP, Keep Our NHS public meeting last week, and this meeting, and what's been brilliant is the discussion and what's come, you know, out of the discussion about services and the City of Manchester and mental health, and the need to look at the whole systems within the city that allow recovery to take place as well as in the service, and as well as any sort of unit that we might be talking about. So I think it's difficult to get change, as I said in the beginning, when you've got a traditional service with set numbers of staff and that the same model is recreated, as indeed the discussion has taken place around the model of care in relation to the rebuild of Park House, where the same numbers of staff, the same ratio of staff are pretty much going to deliver the same service. And I really think that needs challenging. It can only be challenged by not just unison, but by, like you say, involving user groups and the community, researchers, cutting edge people like, I don't know if you know the people we've met here, but there's people like Joanna Moncrieff, who's a consultant psychiatrist who talks about the appalling treatment through medication of people with psychosis and has ample evidence and research to show that in the long term this medication does not work as a solution, but even there's evidence that it recreates the same psychosis, symptoms of psychosis, and it has horrendous physical physical effects on damaging effects on people's bodies. And so that for me is the most important, that we widen this discussion, and that, you know, because staff do tend to, you know, if you've got a culture, they tend to recreate themselves, and change is very, very slow within the cultures, and the only way it can change is by widening it out into the community. So I'm absolutely, I'm really pleased this organisation have come to light for me. The research as well, I just wanted to make the point about the way research does very rarely gets to the front line because people are firefighting, but there's masses of research for centuries. I think you would look into research on psychosis and schizophrenia and see how terrible it was, how the grey matter in the brain has deteriorated, how absolutely terrible. And you feel like committing suicide when you'd come out of it. And given they were saying it was so devastating, the actual research that was done about, well, if it's so devastating on the brain, what can be done to support the person with learning and with regaining the social roles and the support that they need. There was hardly any of that, but now that has changed. And partly because, you know, the debate has opened up, there's masses of evidence on neuroplasticity, the need for people to be engaged in learning and part of society, anxiety and trauma, as you say, the need to empower our service users to be able, people who've had these diagnoses, which again, there's evidence that they shouldn't be given them because they're damaging, to empower them to sort of, you know, see it in a different way, a way that's empowering to them and enables them to move forward and take positive opportunities rather than being fearful of a society that's so exclusive, if that's the right word, to them. So I'm really glad about the building. Yeah, I agree that you need to see the flexibility that's available. If there isn't any, and there really isn't any, then like Paul says, question making what goes on better and fighting for better community services. Service users are quite often in a bad...
Could you wind up, please?
Okay, yeah. Just someone mentioned about people being discharged from mental health services, step down, and the service user network, that's one of their biggest issues. And I think service users are put in that position, aren't they, where they're fighting to be part of a service that isn't that great, because being not in the service means loss of benefits, loss of support, and support networks and everything. So they're in a situation where they're constantly fighting the little things. Thank you.
Delegates to make a decision.
Thank you.
So in terms of how we're going to deal with this now, so say the voting will just be for delegates to Manchester Trades Council. So the Trades Council will add its name to that letter. Would anybody like to make any additional proposals of an action, you know, a simple action that we should take?
Yeah, I think we should look at writing our own letter. Sorry, can I just get rid of the echo? I think we should look at writing our own letter, taking into account some of the points that have been made in the chat. And I think in particular, some of the points that have been made by really active trade unionists who work in mental health services. I think our job as the Trades Council should be to put forward some of the points that they've made. So I would suggest we write a separate letter as well, making the points that aren't covered in the letter we've just signed.
Okay, thanks. So that's a fairly clear proposal. And can I just, in terms of the mechanics of making that happen, because I appreciate from the discussion we're on a fairly short time scale, am I to assume that the task of writing that, obviously in consultation with some of the other people who've contributed, would lie with the Trades Council officers to get that finalised and sent off. Is that what you're driving at, Annette, or are you thinking we mandate some other group of people to do it? Or
no, that I was thinking the Trades Council officers do it based on the points that have been made verbally and in the chat.
So that's 10 votes in favour and none against.